obviously when Briana wrote into our show, we knew we needed to help. We actually sent her to see board-certified dermatologist Dr. Sonia Batra to see if she could figure out what was the cause of her skin condition.
I know you're here to talk about your skin. Tell me what's been going on.
Well, for the last 8 months, I've ceased using any topical steroids, so I'm just really red and blotchy everywhere. To combat that, my dermatologist put me on a topical steroid.
And how frequently were you using those?
Twice a week from neck down, and I was taking antibiotics and an anti-fungal oral every day.
Wow, and for how long were you doing that?
This was on and off for about 3.5 years.
Did you ever have a culture? Did anybody ever tell you what type of fungus you were treating?
No, I'd never had any of those done.
What did they tell you about your skin?
They were just saying that I had severe atopic dermatitis and that I needed to go back on the topical steroids.
So you were basically told to escalate the steroid use?
Yes. I actually did some research of my own and I came across something called topical steroid withdrawal, and all the pictures that came up, I matched those pictures.
What I'd love for you to do now is to change into a gown, and then actually I'd love to take a look at your skin and see what's going on. The neck is pretty itchy for you too. You feel like it's scratching here. So now that I've examined you, I actually think I should do a culture swab just because it hasn't been done before. I am concerned that you might have a secondary bacteria that could be fueling some of this inflammation. What I'd like to do is go ahead and review the test results that you sent to me, and then we can certainly discuss this further.
Awesome.
Dr. Batra joins us now via Skype. So, Dr. Batra, what did you find?
So I do think that Briana has had this long-standing, very severe atopic dermatitis, and she was told to use these steroids as management. But steroids are great in a quick fix. They're great as an anti-inflammatory. But as she mentioned, she'd never really had a culture to test what might be fueling some of the underlying inflammation. And when we did do the culture, we found that she had a fairly resistant form of bacteria called MRSA, or methicillin-resistant Staph aureus. And because it's such a resistant form of bacteria, I don't think she'd ever been placed on the right antibiotics.
So, where does she go from here?
Rather than focusing on the steroids and the anti-inflammatories, so it's really getting her away from the steroids, getting her on prescription strength barrier creams, the right maintenance regimen, and really trying to restore that seal and wall to the skin.
Briana, I mean, Dr. Batra is always so amazing at doing the medical detective work, and of course we know the skin is the largest organ in the body, so she's a pretty big detective despite her petite frame. But you were actually your own medical detective and were partially dead on with the diagnosis in terms of the overuse of steroids, and that in the short term, as Dr. Batra said, it can be great, but in the long term it can do a lot of damage. How does it feel now that you have all of these other pieces to the puzzle solved and you're going to be able to move forward?
It's incredible. It's so reassuring.
Well, Briana, we are rooting for you. We know you're in great hands. So best of luck getting this resolved. Dr. Batra, it's always a pleasure. Thank you so much.